Representative Wolgamott.
Thank you, Madam Speaker and members. We are living in dangerous and unprecedented times. The spread of the coronavirus throughout Minnesota has changed our lives as we know it. This is evidenced here in the Minnesota House of Representatives, where we're changing the way that we do our work. Here with social distancing, with teleconference, with Zoom, with members voting remotely. Minnesotans all across the state are doing the right thing and are staying at home and are taking action to stop the spread of coronavirus. But unfortunately, Madam Speaker and members, there are some Minnesotans who don't have that luxury, who can't do their job from homes. There are over 150,000 Minnesotans who continue to do their jobs out on the front lines of fighting this pandemic every single day. Our public safety workers, such as firefighters, who, when a building is burning and when people are running out, our brave firefighters are the first ones to run into that building. Our police and peace officers, who are on our streets and our communities, making sure that we're all safe. Our paramedics and EMTs, who are first on the scene in an emergency. Our corrections officers, who are going into our correctional facilities and making sure that they remain safe and secure. It's our healthcare workers, who are also on the front lines of caring for ourselves and our loved ones during this pandemic. Our nurses, our healthcare providers, assistive employers who are in our hospitals, who are in our healthcare facilities, dealing directly with Minnesotans who have COVID-19. It's our long-term care providers who are making sure that even in this time of crisis, that our most vulnerable, that our elderly, family members and loved ones still get the care that they need. It's our home health care providers who are braving it in our homes, going in and making sure that Minnesotans who need care from home can get care from home. And it's the child care workers who, under Governor Walz's executive order for the children of those workers that have been exempted and are still continuing to work, it's the child care providers who are making sure that our children continue to get the care and love that they need so that our essential workers can continue to do the work that they need to do. So, Madam Speaker, I want to thank these brave men and women who hold these positions and put themselves and their families' physical health at risk. But I want to make sure that by doing these jobs, they're not putting their financial health at risk. So, Madam Speaker and members, that's why I have authored House File 4537, which presumes that if these workers who are in these occupations that I outlined contract COVID-19, it creates a presumption that they did it on the job and are eligible for workers' compensation benefits by showing a positive lab test or written diagnosis from their doctor. And Madam Speaker, in crafting this bill, we wanted to make sure that we do have due process. So, members, you'll see in the bill that there is a process for the employer, the insurance company, to rebut the presumption if they can show that employment was not direct cause of the disease. So this is a good and fair proposal to have the backs of these essential workers. Madam Speaker and members, a few other key provisions of this bill. The date of injury is under workers' comp is presumed to begin when the worker is unable to work because of experiencing COVID-19 symptoms. This bill sunsets on May 1st of 2021 and requires the Department of Labor and Industry to do a report to the Workers' Compensation Advisory Council by January 15th, 2021. So, Madam Speaker, I want to thank these frontline responders. I want to thank the public safety workers, the healthcare workers, the child care providers who do these essential jobs. I want to thank the bipartisan support that this bill has received, and I will urge a green vote. And with that, Madam Speaker, I'm glad to stand for any questions.
Representative Albright.
Thank you, Madam Speaker and members. We're in this together. And I think House File 4537 represents some very good work on behalf of everyone in this state, not only if you're a business owner, but if you work for a business as well. I'd like to thank the membership of the Work Comp Advisory Commission as well as the task force that was put together. I'd like to extend my thanks to Representative Winkler and to Representative Sundin and others who have worked tirelessly to fashion a bill that is bipartisan in nature and brings together all sides around the people, as Representative Wolgamott has said, are on the front lines in support of those that have been stricken with COVID-19. I'd like to make special note to Representative O'Driscoll for his assistance in putting this language together and working side by side with the other members of this task force. Members, this is a first step. This COVID-19 crisis that we are under is definitely evolving at a very rapid rate. This is a good first step to recognize that the first responders are being taken care of. And so with that, members, I urge a green vote, and I thank you, Madam Speaker.
Representative Petersburg.
Thank you, Madam Speaker. I concur. This is a good start. I have a letter in my pocket from the Speaker indicating that we are essential services, every one of us here. And so because this is a first spot and first start, next week I hope we can get back to the full-blown work that we need to do, whether it's remotely or here in the chamber, I don't care. But the individuals elected us as a whole to do legislation, not two from each chamber to provide this. So we need to move forward with this. We have self-inflicted a financial crisis that we need to deal with over the next few years, and we have to start right away. So I also applaud the governor for the steps that he's taken, whether or not he has challenged and done the right thing, we will soon see, because I know that he's had 3 weeks now to prepare for this. I think we're ready, and I think we need to continue moving forward. So let's pass this bill, but let's get back to work next week as well and do the rest of the job that we were elected to do. Thank you.
Any further discussion? Representative Sundin.
Thank you, Madam Speaker. Thank you, Representative Albright, for recognizing that this is the first step. There's plenty of workers out there that will be affected by the COVID-19 crisis, and among those are grocery store workers, truck drivers, people that are exposed every day. And I'd like to thank the author for doing good work, but this is a first step. There's plenty more work to do, so let's take care of Minnesota workers at every chance. Thank you.
Representative Scott.
Thank you, Madam Speaker, and thanks for all the work that's gone into this bill, and thank you, Representative Wolgamott, for bringing it forward. I do have a couple of questions for the bill's author, if he would yield for a question or two.
He will yield. Representative Scott.
Thank you, Madam Speaker. Representative Wolgamott, I had some questions about how a person would be deemed as qualifying to get this benefit, and you stated that they would have to have a test done. I want to make sure that, because the language isn't real clear here, it sounds to me like a nurse practitioner could say, yes, this person has symptoms, and so write them a note, and they could take that and get the work comp benefit. And I just want to have you clarify in the record what the criteria are for qualifying for this benefit.
Representative Wolgamott.
Thank you, Madam Speaker. In the bill that is hopefully been provided, you can get a copy or you can find it online. If you'll turn to page 4 of the bill, at the very top of the page, on line 4.1, the employee's contraction of COVID-19 must be confirmed by a positive laboratory test, or if a lab test is not available for the employee, as diagnosed and documented by the employee's licensed physician's assistant, or licensed advanced practice registered nurse based on the employee's symptoms. A copy of the positive lab test or written documentations of the physician's assistants, or APRN, which is the advanced practice registered nurse for those watching at home. The diagnosis must be provided to the employer or to the insurer. Representative
Scott.
Thank you, Madam Speaker. And Representative Wolgamott, yeah, I know, I read all that, but my concern is if there's no lab test available, that a licensed physician's assistant or a licensed advanced nurse practice person could just write a note, in essence, saying, yes, this person has symptoms. I think it's COVID, but, you know, there's no test that's been performed. And so that part of this bill gives me concern. And then I understand that there is a presumption that has to be overcome here. But I also have a question about if Representative Wolgamott would yield again, Madam Speaker, to another question.
Representative Wolgamott will yield. Representative Scott.
Thank you, Madam Speaker. So I'm wondering what the rules of evidence are here that will be played out in court. Do you know the answer to that question about what the rules of evidence will be? Will it be normal and customary rules of evidence, or what will apply here?
Representative Wolgamott.
Thank you, Madam Speaker, and thank you, Representative Scott. For those who are watching or for members, we have outlined the process for the employer, the insurer, to rebut the presumption is on line 4.7 through 4.10. I guess we would read the denial of liability under this paragraph must meet the requirements for a denial under section 176.221, subdivision 1. I don't have that exact section of the subdivision handy, but I'm sure that either myself or a member of our staff here could provide that for you. But again, the answer to your question can be found under section 1.76.221, subdivision 1. Thank you, Representative Scott. Thank you, Madam Speaker.
Representative Scott.
Thank you, Madam Speaker. Well, my understanding, and I just learned of this kind of, and I apologize for not reading the cross-reference before I got in this morning, but my understanding of that cross-reference is that the normal and customary rules of evidence will not be applied here, and in fact, they may be something far less restrictive, and so that gives me pause for concern too. If the bill's author would continue to yield, Madam Speaker.
He will yield. Representative Scott.
Thank you, Madam Speaker. Representative Wolgamott. Why wouldn't these employees be covered already for getting an illness that they contracted at their jobs?
Representative Wolgamott.
Sorry, Madam Speaker and Representative Scott, would you mind repeating that first part of the question? I couldn't quite hear it.
Representative Scott.
Thank you, Madam Speaker. Representative Wolgamott, why wouldn't, under current law, these employees be covered for work comp already?
Representative Wolgamott.
Thank you, Madam Speaker. Representative Scott, the reason why I began working on this bill weeks ago is because we had seen both in other states and also in some places here in Minnesota where these frontline responders were being asked to, who contracted COVID-19, were being asked to dip into their own PTO and their own earned benefits. And we want to send a message loud and clear that if you are a public safety worker, if you are a healthcare worker, if you are a child care worker, that we have your backs. That if you're going to put your physical health on the risk to continue these vital services, we're not going to be asking you to put your financial health on the risk. That's why I worked on this bill. That's why I brought this bill forward. And that's why I hope you'll join me with a green vote.
Representative Scott.
Thank you, Madam Speaker. And this will be my final question to the bill's author, if he would continue to yield.
He will yield. Representative Scott.
Thank you, Madam Speaker. And Representative, I'm just wondering, there's no fiscal component to this bill, and I know that this is still a work in progress, but I'm wondering if you might have an idea of what you think this might cost and how it might be paid for.
Representative Wolgamott.
Right now, there are Minnesota firefighters who are going into burning buildings, putting themselves at risk for COVID-19. Right now, there are nurses in the state of Minnesota who are in our healthcare facilities who are putting themselves at risk of contracting COVID-19. Right now, there are child care providers who are watching the children of essential working Minnesotans who are putting themselves at risk of COVID-19. We are in a state of emergency, Madam Speaker and Representative Scott. That's why I put this bill forward. We are continuing to work with different entities throughout the state to make sure that we can set this structure up in a way that is fiscally solvent. But most importantly, we need to have the backs of the Minnesotans who are putting themselves out there to make sure that law and order is maintained, to make sure that our healthcare system functions, elections and to make sure that our children are cared for. So we're continuing to work on that. As you mentioned, this is a work in progress, and I'm glad to continue to work with you and anyone in your caucus, anyone in the chamber, to make sure that we can do this for our frontline responders and do this in a way that's fiscally solvent.
Representative Scott.
Thank you, Madam Speaker. Well, I didn't really hear an estimated number in there or anything. Members, the reason I asked that question is we all know we're going to be heading into probably a significant budgetary deficit here in the state of Minnesota. And I'm not denying that those frontline workers are important. I have a daughter that doesn't live in this state that's one of those people. And so I want to make sure that they're treated well. But I also want to make sure we can pay for this and not have to sacrifice something else on that's another appropriation. So to the extent possible, I would really, urge you to look closely at whatever the fiscal cost might be of this. I know they're lowering possibly the estimated numbers of folks that are going to contract this, and that's good news. And hopefully that would cause that number to go down. But it's very much a concern to me what all of this is going to cost at the end of the day. And we have a lot of things that we have to budget in the next little while here. And so I just want to make sure that we're doing the responsible thing in the state of Minnesota for the taxpayers. Thank you.
Representative Dowd.
Thank you, Madam Speaker and members, and thank you to everybody who worked to put this together. I know there was folks on both sides of the aisle and both chambers that worked long hours to put this legislation together. But most of all, I just wanted to say a brief thank you to all the folks who are on the front lines fighting this virus and taking care of the Minnesotans who are suffering both from it and working to keep folks safe from getting it. So our very heartfelt thanks to everyone at home for doing your part to keep Minnesotans safe, but most of all, thank you to those first responders and healthcare workers who are working to keep us safe. Thank you, Madam Speaker.
Representative Winkler.
Thank you, Madam Speaker. Members, thank you, Representative Wolgamott, for bringing this bill forward, and for Republicans in the House and Senate and Democrats in the Senate for supporting it, and of course the Walz administration for supporting it as well. I just wanted to address a couple of points that Representative Scott raised. First of all, the presumption in law doesn't affect the rules of evidence that will be used to judge whether or not the presumption has been established or not. The employee simply needs to prove by reason of a test, a positive test, or a laboratory, if a laboratory test is not available, a diagnosis that they have COVID-19. That is all they need to establish, and it shifts the presumption to the employer. And the employer, in order to overcome that presumption, has to establish that the employee was either not exposed at the workplace or that exposure could not have been a cause of the illness. The challenge here is that it is very difficult for people who are exposed to this in the community to prove exactly where they got it. So if we want nurses, if we want healthcare professionals, if we want home healthcare workers, if we want firefighters, paramedics, EMTs, police officers to be in the community serving all of us, it will be very difficult for them to prove where they contracted COVID-19 if they contract COVID-19. So the purpose of the presumption is to shift the burden to the employer or insurer to establish that, in fact, it was not at work that they got this. So it doesn't change the way the evidence will be evaluated. It simply changes what the legal presumption is. We are looking at a significant cost for this bill. The Department of Commerce, the Department of Labor and Industry, and Minnesota Management and Budget have created models and some projections. We know for sure that their models and projections will be wrong because they are projections. But their initial number is something like $320 million with a worst-case scenario of $580 million. It's important to note, however, that the money that we put into the workers' comp system does not come from the state general fund. It comes from either self-insured workers' compensation plans or premiums paid to private insurers who provide that benefit. So we have brought forward several ideas to address how to pay for this, including allowing employers to provide for a coordination of benefits so that they can offer paid leave to employees who might be out for 14 days, so long as that paid leave doesn't come at the expense of an employee's benefit. We have proposed that the Workers' Compensation Reinsurance Association Fund be able to take these claims on immediately and to start to spread that cost out amongst the whole system. And Representative Albright has brought forward the concept of a special fund supported by the State General Fund that would help offset some of these costs. We're very cognizant of the importance of keeping the workers' compensation system solvent, and it is vital that we do so, just as it is going to be very important that our unemployment insurance system remains solvent through this crisis. So we don't know yet what mix of public and private resources will be brought to bear, but we do know that we need an answer to that question very quickly. I think it would be helpful to have a task force to focus on this and to limit the number of people studying this issue and bringing back a report. But I think the goal is that by the end of April, and once we have federal funds, a better understanding of what federal funds may be available to us, by the end of April, we will come back with a system for distributing the cost of this bill out amongst the workers' compensation system and probably among the taxpayers of the state and the nation as well. So that is our goal. The first thing we need to do, however, is ensure that if a worker is contracting COVID-19 tomorrow, that they have workers' compensation in place to protect them. That is why we are here today on short notice. That is why they have come to us with great urgency, because they know they can't not do their duty. They have to go in to help people. They have to be the ones to respond. They have to show up at a person's house who's disabled and look after them, regardless of who might have COVID-19. The work must go on, and what we're trying to do is make sure that the financial risk doesn't fall just on those people. That's what this bill does. It is groundbreaking and it is unprecedented, and we will be figuring out how to pay for this and many other things as the months wear on. We don't know the course of this disease. We do not know who will be infected or how many lives will be lost or affected by this in Minnesota. But we do know that we have the resources in this state to deal with it as best we possibly can. The intellectual, the emotional, the financial resources of the people of Minnesota are adequate to take up this task and to create a state that works for all of us when it is over. So members, I would ask for your yes vote on this bill. As we have said, there are many more stages of this to come, but I believe very strongly that our state government in Minnesota and the people of Minnesota are up for this challenge, and that we will prevail. Thank you.
Seeing no further discussion, the clerk will take the roll on the bill.
Give me a thumbs up. Go ahead.
Acom.
Aye.
Acom, aye. Albright. Albright, aye. Anderson.
Aye.
Anderson.
I'm not making that up.
Aye.
Anderson, aye. Backer.
Aye.
Backer, aye. Bonner.
Aye.
Bonner, aye. Barr. Bonner, Barr. Barr, no. Baker. Baker, aye. Becker Finn.
Aye.
Becker Finn, aye. Bennett.
Aye.
Bennett, aye. Bernardi. Bernardi, aye. Bierman. Bierman, aye. Bull.
Aye.
Bull, aye. Brand. Brand, aye. Cantrell.
Aye.
Cantrell, aye. Carlson, A.
Yeah, you aye.
Carlson, A, aye. Carlson, L. Carlson, L.
Aye.
Carlson, L, aye. Christensen. Christensen, aye. Claflin.
Aye.
Claflin, aye. Considine.
Aye.
Considine, aye. Daniels.
Aye.
Daniels.
Ryan had something good to say. So it's fully charged? Appears to be.
Daniels.
Aye.
Daniels, aye. Doubt. Doubt, aye. Davids. Davids, aye. Davney.
Dabney votes aye.
Dabney, aye. Dean.
Aye.
Dean, aye. Damath.
Aye.
Damath, aye. Detmer.
Aye.
Detmer, aye. Drazkowski. Drazkowski, aye. Eklund. Eklund. Edelson.
Aye.
Edelson, aye. Elkins.
Aye.
Elkins, aye. Erickson. Erickson.
Aye.
Erickson, aye. Fabian. Fabian. Fisher.
Fisher. Aye. Fabian.
Fisher, aye. Franson.
Aye.
Franson, aye. Freiberg.
Yes.
Freiberg, aye. Garofalo. Garofalo.
Garofalo votes yes.
Garofalo, aye. Gomez. Gomez, aye. Green. Green, no. Grossel.
Aye.
Grossel, aye. Grunhagen.
Aye.
Grunhagen, aye. Gunther.
Aye.
Gunther, aye. Haley. Haley, aye. Halverson.
Aye.
Halverson, aye. Hamilton.
Aye.
Hamilton, aye. Hanson.
Aye.
Hanson, aye. Hassan.
Aye.
Hassan, aye. Hausman.
Aye.
Hausman, aye. Heinrich.
Heinrich. Aye.
Heinrich, aye. Heinzemann.
Aye.
Heinzemann, aye. Herr.
Aye.
Herr, aye. Hertos.
Hertos. Aye.
Hertos, aye. Hornstein.
Aye.
Hornstein, aye. Howard. Howard, aye. Hewitt.
Aye.
Hewitt, aye. Johnson.
Johnson. Aye.
Johnson, aye. Jordan. Jordan, aye. Jurgens.
Aye.
Jurgens, aye. Keel.
Aye.
Keel, aye. Cleavorn.
Aye.
Cleavorn, aye. Cagle.
Aye.
Cagle, aye. Katiza Watun.
Aye.
Katiza Watun, aye. Kosnick. Kosnick, aye. Kreshaw.
Aye.
Kreshaw, aye. Kunish Podine.
Aye.
Kunish Podine, aye. Lehman.
Aye.
Lehman, aye. Lee.
Aye.
Lee, aye. Lesh.
Aye.
Lesh, aye. Liebling.
Aye.
Liebling, aye. Lean.
Aye.
Lean, aye. Lilly. Lilly, aye. Lippert.
Aye.
Lippert, aye. Lislegard.
Aye.
Lislegard, aye. Long.
Aye.
Long, aye. Lucero. Lucero, aye. Lewick.
Aye.
Lewick, aye. Mahoney. Mahoney.
Aye.
Mahoney, aye. Mann.
Aye.
Mann, aye. Mariani. Mariani. Markwart. Markwart, aye. Mason. Mason. Mason, aye. McDonald.
Aye.
McDonald, aye. Mecklin.
Aye.
Mecklin, aye. Miller.
Aye.
Miller, aye. Moeller. Moeller, aye. Moran.
Aye.
Moran, aye. Morrison.
Aye.
Morrison, aye. Munson.
Aye.
Munson, aye. Murphy. Murphy.
Aye.
Murphy, aye. Nash.
Nash. Aye.
Nash, aye. Nelson M.
Aye.
Nelson M, aye. Nelson N.
Aye.
Nelson N, aye. New.
Aye.
New, aye. Nor. Nor, aye. Nornis.
Aye.
Nornis, aye. Novotny.
Aye.
Novotny, aye. O'Driscoll. O'Driscoll, aye. Olson.
Aye.
Olson, aye. O'Neill.
O'Neill, no.
O'Neill, no. Pulowski.
Aye.
Pulowski, aye. Purcell. Purcell, aye. Petersburg. Petersburg, aye. Pearson.
Aye.
Pearson, aye. Pinto.
Aye.
Pinto, aye. Poppy.
Aye.
Poppy, aye. Poston.
Aye.
Poston, aye. Pryor.
Aye.
Pryor, aye. Quam. Quam, aye. Richardson.
Aye.
Richardson, aye. Robbins. Robbins. Runbeck.
No.
Runbeck, no. Sandell.
Yes. Aye.
Sandell, aye. Sandsted.
Aye.
Sandsted, aye. Salk.
Aye.
Salk, aye. Schumacher.
Aye.
Schumacher, aye. Schultz.
Aye.
Schultz, aye. Scott. Scott, aye. Stevenson.
Aye.
Stevenson, aye. Sundin. Sundin, aye. Swazinski.
Aye.
Swazinski, aye. Tabke.
Aye.
Tabke, aye. Tice. Tice, aye. Torkelson.
Aye.
Torkelson, aye. Erdahl.
Aye.
Erdahl, aye. Vang. Vang. Vogel.
Aye.
Vogel, aye. Wagenius.
Aye.
Wagenius, aye. Wozlowick.
Aye.
Wozlowick, aye. West.
Aye.
West, aye. Winkler. Winkler, aye. Wolgamott. Wolgamott, aye. Zhang Jie.
Aye.
Zhang Jie, aye. Zhang Ti. Zhang Ti, aye. Joachim.
Joachim, aye.
Joachim, aye. Speaker Hartman. Speaker Hartman, aye. Eklund. Eklund, aye. Fabian.
Aye.
Fabian, aye. Mariani. Mariani. Robbins.
Robbins, aye.
Robbins, aye. Vang. Vang. Mariani. Mariani, aye. Vang. Vang, aye.
You are muted.
There being 130 ayes and 4 nays, the bill is passed and its title agreed to.